In tonight's toolkit, a key to your health. How many times have you shrugged off a sore back, some little pain here or there, chapped lips, things like that, you know? Well, maybe you shouldn't be doing that. It could actually be a signal of a very serious underlying health problem. To help us out with all this now, Dr. Keri Peterson joins us again from Lenox Hill Hospital with some surprising secrets behind is that one of the symptoms? Not being able to talk? Symptoms behind common things that we just think, oh, that's nothing. What could be more common than chapped lips?
That's right. I mean, this time of year, they're dry, they're cracked. You think, oh, just put a little lip balm on it.
That's right.
But if it's not getting better, it may be that you have a yeast infection of your lips.
You're kidding me.
Yeah, and what happens is, what do we do when we have dry lips? We lick them, and then the saliva pools on the corners or on the lips, and then you grow yeast. It's a perfect breeding ground.
Oh, that is so disgusting.
So the way to treat it is first avoid getting dry lips to begin with. Make sure you wear a lot of heavy lip balm if you feel that it's beginning. Make sure you stay well hydrated.
Right.
And if that's not enough, you may need to see the doctor to get an antifungal cream.
Who would have thought it starts here in a different place and ends up somewhere else entirely? Same thing with cracked corners of the mouth?
Cracked corners, it may be the yeast, but it can also be a sign of vitamin B deficiency. So if you notice you have cracked corners, try a multivitamin.
Right shoulder pain, and specifically the right.
The right shoulder. You know, a lot of people come to me saying, my shoulder hurts, I think I'm having a heart attack. It actually may be gallstones, especially if you notice it after you've eaten a meal. It is referred to the shoulder. So if you notice that you're eating fatty meals and you get shoulder pain, something to consider.
Burning in the ball of your foot. This is all fascinating.
Yes, well,
I'm afraid to hear what you're going to say.
We women love our high heels, but if you're wearing high heels and you have numbness of the balls of your foot, you may have a Morton's neuroma.
Which is?
It is an inflamed nerve between the third and the fourth toe, and it's caused by wearing high heels or if you have a very high arch. So first try changing your footwear if you notice this.
Okay, we all know what tingling on the inner thigh means, but what about tingling on the outer thigh?
People come to me with tingling on the outer thigh saying, Dr. Keri, I think I'm having a stroke. Well, the first question I ask them is, are your pants too tight?
Oh, come on.
Yes. If you gain a few pounds and you don't go up in your pant size or you want to squeeze into those skinny jeans, you actually may be doing yourself a little harm. The nerve that runs along the outer thigh can get squashed by tight pants, become inflamed, and you get numbness on the outer thigh.
Who knew? You are full of fascinating information. You must come back.
Well, thank you, Katie.
Wasn't that interesting?